Welcome to the MS&Me Radio Network, a division of the Multiple Sclerosis Global Support Network. The following program broadcast is an original creation by the broadcast entity. Discussion within the following broadcast should be used for informational purposes only and is not a substitute for professional medical advice or consultation. Before considering application of any broadcast content in the following program, please consult your healthcare provider. If you feel you are having a medical emergency, please contact your local health services for immediate assistance. MS&Me Media and the Multiple Sclerosis Global Support Network do not guarantee or warrant the accuracy of information in the broadcast to follow. The Multiple Sclerosis Global Support Network provisions broadcast services to program hosts. Information discussed in the broadcast does not necessarily reflect the views, opinions, or goals of the network and are solely those of the show broadcast host. Should you wish to host a broadcast, please visit our website at msmemedia.com and submit a request to become a program host. We thank you for listening to the MS&Me Radio Network. Enjoy the show. Get ready for Ask MS&Me. Have an MS-related question you want to answer by your fellow MSers? Use hashtag AskMSME on any of your social media accounts, and we'll get as many answered as possible. Get ready. Here comes Ask MS&Me. Welcome to Ask MS&Me. Joining in the fun today are hosts Anisha Hankins, Ted Michael, and I'm Erica Richardson. Hi, guys. Welcome.
Hi, Erica. Hi, Anisha.
Hey, Ted.
Hi. Okay, so let's get started. Ted, do we have the questions coming in on social media to our hashtag AskMSME?
Yes, our first one. Does MS itself or just medication cause hair loss?
Oh, good question.
Yeah.
Okay, who wants to take that one?
I've got some hair experience.
Okay, all right, you can go ahead with that one.
I was a hairstylist before.
Oh, yeah,
before MS.
yes, absolutely. You have professional experience on this one, so we'll let you start with this one.
Okay. MS itself doesn't cause hair loss, but sometimes people with MS have other autoimmune diseases. Multiple autoimmune syndrome.
Yeah.
Which can lead MSers to have alopecia areata. That is a common autoimmune skin disease causing hair loss on scalp, face, and sometimes other areas of the body. In fact, its affects about 6.8 million people in the U.S. It can hit old, young, both sex, all ethnics. Anybody can develop this disease.
Mm-hmm.
Unfortunately, there is currently no cure, although there are some forms of treatment that can be suggested by your doctor. Say you talk to your doctor, he should be able to help you with something. Get you on some. There's steroid shots, powerful anti-inflammatory drugs they can take either through injection into the spots. They can do topical applications, oral medication. Besides all of those, you can try some. There are some natural things you can try, such as acupuncture, aromatherapy. It's just one of those. You do what you can.
Yeah. Try till you see what works for you personally.
Yep.
I know Anisha and I both have experience with this as well because we both battle lupus. So I know I've had just handfuls coming out, and that's separate from any chemo or anything else I've had in my life. It just handfuls of hair. So I've had to deal with that. Just recently, I had an amazing experience with my longtime hairdresser. She's been doing my hair for quite a while, and she knows that she would always have to cut my hair in a certain way and keep it longer in the front so I could cover all the old scars and patches from over the years. And, I had all those different lengths, a billion different lengths where it would fall out and grow back, fall out and grow back.
In some places, it just never grows back. So she would leave parts long on one side so I could just comb it over, and hide everything. I wore it in a ponytail for years and years at work to hide it all so nobody knew what was going on. And this year, she was cutting my hair and she just started welling up in tears. And I said, "What?" She said, "I think we might be able to do it this time." And I said, "What?" She said, "The part. We might actually be able to part your hair. A real part. Have enough hair on each side to do a real part." And she did it, and I busted out in tears. I'm sure the whole salon thought we were crazy, but it was a major moment, and to get to share it with her, somebody who understood how long it had been and what I'd been through. And we took pictures, of my part. And it was an amazing moment, but it's a very emotionally painful thing for a lot of us fighting autoimmune diseases. It's not just the medications, like they say. It can be both painful. All right, let's see if anything else is coming in. Another question. Oh, we do have one from our ladies group on Facebook. So that's the Facebook MS&Me Ladies Only group. My question is, can I drink alcohol with MS? Okay, well, it can be okay in certain cases. Of course, talk to your doctor to see what is the answer in your particular case. But one potential benefit of drinking alcohol is the possibility that moderate amounts may be good for your heart health. Why is that important if you have MS? There's some data that MS patients are a little more likely to have cardiovascular disease than the general population. So it might be beneficial, for you in particular, to drink in moderation. So how much is moderate? We all wonder that. But the government's dietary guidelines for Americans says it's 1 drink a day if you're a woman, and then up to 2 if you're a man. So it does differ from men to women. Cons, there can be many cons, why you might want to think twice and discuss it with your doctor. Things you should know before you drink would be alcohol affects the central nervous system, meaning it can impact your judgment, balance, and coordination. And since with MS we already have those issues, it could lead with more problems with your balance and coordination. Adding alcohol on top of that, it might not be a good mix. Another reason to be cautious is that alcohol can make you feel like you need to pee in a hurry, and that can be already a problem in your case. So you might want to think about that. Alcohol can affect how well you sleep. And many of us have that problem, where we cannot get enough sleep. We already are on medications for that issue, so that drinking would not be great on top of that. But not everyone reacts to the alcohol in the same way. Some people may be more sensitive than others to how it impacts their MS symptoms. So while drinking in moderation might not impact you at all, even 1 drink might be too much for someone else. You just don't know. The best thing, use common sense, and then, of course, speak with your doctor, because some of the drugs you take might not mix well with alcohol. Many MS medications have potential for irritating, damaging your liver. On top of that, specific medications used to control your MS can interact with your alcohol and then change the way you feel. So it's just, beware, be aware, and then talk to your physician on that one before you make your final decision. Okay, any more coming in, guys?
As a matter of fact,
Go
I
ahead.
have another question that's coming from our ladies group,
Okay.
MS&Me Ladies Only, and it's, why do things come and go and never stay in the same place? That's a great question when dealing with MS. In the most common type, which is relapsing remitting multiple sclerosis, the symptoms do come and go. They can run the gamut from mild tingling to more severe with vision loss as a result of there being some optic neuritis. However, MS is such a tricky disease because so many other conditions also cause similar symptoms. A lot of times it's a little bit difficult to kind of figure things out, which is kind of unfortunate for not only us, but for doctors as well in diagnosing. This means that symptoms of the disease can occur anywhere in the body, and everyone's experience of MS is going to be different, which is exactly why we hear it termed as a snowflake disease, because my MS, what I go through, would not be, one of my great friends that I've met that has MS, or Ted and Erica. A lot of things with our MS is completely different, right?
Right.
What goes on with us is kind of different. So it's where it gets that disease or that term of a snowflake disease, is because truly when you look at a snowflake, no two are exactly identical. With that said, there are a few symptoms that are fairly common with everybody, which include fatigue and numbness, the tingling, blurry vision, problems with mobility and balance, muscle weakness and tightness of different parts. Most people will experience a few of these symptoms and not always at the same time. It's, again, that come and go thing, where it might be, 2 to 3 and not the others, and then, they kind of can switch off. What's more, the course of MS is so unpredictable for patients and a lot of times for doctors as well. Some people find their symptoms get worse over time, while others, they do find that those symptoms come and go.
Yeah, I think that's a big confusion, especially to patients who are newly diagnosed. They want, kind of a roadmap to their disease, and it's hard to really give them one because our central nervous systems can be under attack at different places at different times. Inflammation can have a factor in all that, and we just don't know. We got comorbidities, other diseases and conditions is what that means, going on with, from patient to patient that complicate things. And, they can kind of trip off of each other and exacerbate each other. And it's really hard to tell. You can't tell them what they're going to experience, what course their disease is going to take. At any moment, my spine might be under attack at one moment, and then my eyes are under attack the next moment. It's all part of our central nervous system. And we don't know which nerves are being eaten away. The myelin sheath on them are being eaten away. So we don't know if it's our hand giving us trouble one moment, and our leg giving us trouble the next. So it really is. It's hard to tell, and it's very confusing. And, there's a new movement of many, many experts who think it's all one disease, just, different disease courses, different triggers, different comorbidities, all these factors involved, even though MS itself is all one disease. And that's even a harder concept for patients to grasp because we all have such individual experiences. So that was a very good question. Very, very good question.
It makes it hard for the layman person to who doesn't have MS to understand what we go through, because they're used to a textbook thing. You get this and this is gonna happen. You get that and it's gonna happen. With MS, that's not how it goes. So they're not used to that. Really throws off the layman person.
It really does. It confuses them because they're like, well, my coworker's sister has MS and they're not using a walker and they're fine. And then, this other patient comes along that they know and they're in a wheelchair and they're like, what are you doing wrong? They really don't understand the disease, and there's a lot of judgment and hurt involved in that confusion. So I think the more that we all are open and talk about our disease courses, try to educate those around us, then people will understand that, and there will be less judgment involved and more understanding. So that would be, well, they can't really understand exactly what we're going through, but they can have empathy. They can have empathy for our experience, so that would be a good thing. Okay, let's do something else. Yeah.
Looking at too with a lot of times that comparison and contrast.
Yeah.
Not only do we do that in reading comprehension, but people also do it when people are sick. Oddly,
Yeah, it's true.
Like that's the place it's done, but they'll compare, one person that they know that has it to another person that has it, and it's a completely unfair thing to do, but it happens.
It does.
So, it makes it hard, and then it also makes a lot of people that are sick, that are the patients, it makes them end up closing up where they don't say anything, and then they live in this whole isolation thing because they're afraid to say anything, and that can be very difficult. So empathy and understanding and not feeling so misunderstood is definitely very important.
Yeah, it's a big thing. It's a big thing for us. And it happens in more diseases than just autoimmune diseases that are so varied. It can happen for cancer patients because, one woman will be fighting, a type of breast cancer, and, she has one outcome, and then some other female in their world, has a different course, and they get judgment as well. There's many diseases where people don't understand because of different disease courses. But, as we say, we have a lot of other things going on in our bodies besides that one disease, and that can be the game changer. That can be the thing that makes ours a little bit different. So we all have to just educate ourselves so we all understand that a little bit better. Okay, let's see what else is coming in. This one is actually off Twitter. They did use hashtag MS&Me. Do any of you seem to run low-grade fevers a lot? I notice mine at night. Yeah, very good question. Very good question. I do actually quite often. There's a well-known study out of Kessler on temperature and fatigue. It's elevated body temperature is linked to inflammation when otherwise healthy people experience a fever as well in other diseases, i.e. temperature in their joints, from rheumatoid arthritis, which I also have, temperature in the brain in acute stroke patients. But they found that in the study that patients who complained of fatigue with MS had low-grade fevers. It was that slight elevation of their body temperature that was doing that heat sensitivity that many of us have, and was actually kicking off the fatigue. So it is quite common. It's the inflammation in our disease. A lot of people don't realize, they haven't actually researched enough till they've learned that MS is not only a demyelinating disease, it is also an inflammatory disease. Okay, so that inflammation factor in our body can kick off those low-grade fevers. The low-grade fevers then can kick off the fatigue symptom. So it can be very related. And I think we do notice more things like that at night. I mean, even when you have a cold or infection, you'll notice when you lay down at night, you'll really feel the symptoms kind of increase. So I think we become more cognizant as we get quiet and lay down, and of the evening hours, you'll notice that you notice those things more acutely. Have you guys had experience with feeling like you have low-grade fevers at nighttime?
I haven't noticed.
I run, low-grade fevers, and sometimes mine are just random. And again, it's from, when you start dealing with rheumatological issues at the same time.
Right.
Because sometimes comorbidities of MS or, other things in the rheumatological family. So, we're dealing with things like Sjogren's and lupus and stuff like that. There's that, low-grade temperature, and it just so tired. So I deal with them, quite often myself. So definitely can understand that one.
Yeah, I can relate. And I, because of the lupus, I noticed because I run such a low temperature as my average, that's my norm, is actually way below 98.6. It's nothing for me to go in and be 96 point something, 97.2. That's normal for me. So when I hit 98.6, my physician knows that that's a fever, just because they know what my normal is. So it's important to know what your normal blood pressure is, what your normal temperature is. That way, it's quite often for us to have lower than normal blood pressure with MS. So if you know these things and you keep track of it, if it's even normal in the ER, you're like, okay, there's a problem somewhere. Look for the infection. I'm running a fever. Let's start hunting for that infection. So that helps you really help the staff that's caring for you if you know all those things and get to know your body. So that was a very good question. We have one coming in from ladies, the Facebook ladies group. Does anyone get mad, upset, or irritated quicker than usual? Oh, yes. I can say yes on that one. I don't know about you guys.
Yeah, especially when I'm in a relapse. It'll really be.
Yeah, I mean, it can be to a lot of things, as we all know, the dreaded steroids. But in addition to its physical symptoms, MS can have a profound emotional consequence with us. At first, it might be difficult to adjust to the diagnosis you get with this disorder that's so unpredictable. It has, a fluctuating course. It carries risk of progressing over time to some level of physical disability. So that lack of knowledge about the disease and what yours might do, we just don't know, that unknown, it adds to our anxieties that we commonly experience with MS, especially the newly diagnosed. But in addition to these emotional reactions to the disease, the process, the demyelination, the damage to our nerve fibers and the brain, it can also result in emotional changes. So that physical effects of the brain can actually cause those emotional changes. Some of the medications used in MS, like like I just said, the steroids, can also have significant effects on our emotions. So in the face of MS, people tend to focus primarily on their physical health and often, unfortunately, neglect their emotional health, which is an essential component of overall health and wellness. If you look at the main symptoms, look them up, Google the symptoms for MS. For those unfamiliar, you'll see anxiety listed as a major symptom for MS. You'll see depression, unfortunately, listed as a major symptom. And if when we get even more advanced or have maybe a lesion in the a certain center of our brain, we get that confusion oftentimes, or a greater memory loss, and that breeds fear. And sometimes our fear will come out as anger or shortness, or confusion, or we'll say the wrong words and we'll get scared. And that sometimes will lead to our emotional reactions. So there's so many, contributing factors there, both with medications and with the actual just physical course of the disease. So I think that was a very good question. A lot of people are dealing with that. And sometimes they blame themselves and get frustrated, and they don't realize that it's part of our disease. And it's something that those around us have to learn to understand. And it really helps their reaction to you if they understand that. One thing I'd like to tell everybody that was a help for me and my family personally, when I learned more about my disease and learned that I would not read facial expressions and voice inflections as well as some others do. And then I learned that sometimes what I thought was coming out, what I was saying and how I was saying it, was not exactly what I was reading in my brain and had intended. It helped with my personal relationships. My mom has even learned, because she's with me so much, to even ask if she's getting anger from me and she doesn't think that's what I'm meaning to say, or it doesn't fit the conversation, or if she perceives that I'm thinking she's angry at me when she's not, she's saying happy things, and I look confused, she'll ask. She'll be like, "Did you think I was angry?" Because I wasn't, and we'll clarify. We clarify more with each other and with feelings. So I think that's a really good tip. If you're at that point of your progression, or you have, something in that center of your brain that's affecting that for you, it's really good if you learn to clarify for each other. Can help prevent a lot of misunderstandings.
I'm also gonna not really be the negative Nelly, but I'm gonna be the little bit of devil's advocate here. For anybody that is living with this, it's also important that if you find yourself in a situation where someone's not trying to understand you, they're not trying to, help you, they're making fun of you about, anxiety, depression, things of that nature. If that relationship is unhealthy, get out. because
Yeah.
it is only going to progress your MS even faster.
Yeah.
Get out.
Yeah, we cannot stress is our number one enemy. If you are in a toxic relationship, whether it's a, one-on-one relationship, or if it's just a friend or what have you, someone in your life that's being toxic toward you, causing you stress, you need to really consider ending that relationship or getting them out of your life, until they change. It's not you, it's them who needs to make a change, because you cannot change your disease course, and you cannot change the fact that MS causes those reactions for you. So they need to be even more understanding. They need to, if they're bringing negativity and stress and some of the things Anisha said into your life, you don't need them anyway, whether you have MS or not. You don't need that in your life. You need to get out of a, toxic relationship. But yeah, stress is our number one enemy. We have to be really, really cognizant of that. Totally agree. Is there anything else coming across?
Yeah, we got something coming in from the information hub.
Okay.
Depression meds and brain add to irritation or ease it. Not really understanding the question, so the only answer I can give is some depression medications, the side effects can be insomnia, restlessness, agitation. If any of these are, you might want to talk to your doctor about changing your dose or maybe a new medication. Does anybody else have anything they can add to this?
Yeah, the depression medications for depression. Do they actually add to irritation or ease it? Oh, they're saying within treating your depression with medications, can that actually increase anxiety, irritability, or is that actually going to ease that symptom along with the depression? Well, that can be part of it.
The medication.
Yeah.
A medication may work one way for one person,
right,
and another way for another person, because this is a little bit different, but depending on where I get corticosteroids at, because of who's manufacturing them, I'll turn into the Hulk at one place, and then at another place, I'm just as sweet as, I don't know, pie.
Yeah.
You know what I mean? So it just depends on, a person's body. And then think about it. You're dealing with the serotonin levels in the brain. Yeah. Anytime someone's taking, a depression medication, it's leveling out, all of the chemicals of the brain. So yes, it can cause a little more, just like that, the cause may become a little more worse when someone's starting a depression medication where they feel like they can't hear very well. Everything seems like it's in a tunnel, And then all of a sudden, as they get a little more used to the medication, they see that side effect goes away,
Yes.
So that's why I talk about journaling so much. It's important to, write these things down, because if, you've been on the medication, say, 7 to 10 days, and that irritation is kind of not backing up a little bit, it's not backing off, you're not, kind of coming out of it, even sometimes 2 weeks, go ahead and start getting a call into your doctor to get another appointment and explain to them, write it down every day how you are feeling, so that way when you go in, because of your thought processes, you have it written down, so that the doctor is able to look at it. And it's also important to know, too, that there are neuropsychiatrists and there are neuropsychologists as well. And people that have MS, if your insurance will allow you to, or whatever the case may be, especially I think it's more so if the insurance will allow you to, I think it's very important, if you could at all possible, if you guys could, go and see a neuropsychiatrist, because guess what? They're familiar with all things of the brain, to include MS.
Correct.
They're familiar with it. So they'll know a little more better, and you'll kind of maybe sometimes get a little easier pathway, with medicines to, treat things like depression and things like that. So hope that helps you.
Yeah, that's true. Great tips, because, just like when we see an MS specialist, who is not only trained just generally on all the neurological diseases they may see in their practice. An MS specialist had extra training, extra focus on, our MS, multiple sclerosis in particular. Or they might also have other specialties like stroke and some of the other things we deal with. But in particular, they have focused and training on multiple sclerosis. Same thing when you're dealing with mental health professionals, like Anisha said. Instead of just a psychiatrist or a psychologist, if you see a neuropsychologist and a neuropsychiatrist, they've had that special training in neurological diseases that will give them a little more knowledge in how to help with your disease course. So the great tips there. Let's see if anything else is coming in. Ladies again. We have one from our Facebook ladies group. Flashing lights. When I climb into bed and close my eyes, I thought my mobile phone was ringing on silent and the light was flashing. I opened my eyes and no phone call. Shut my eyes, same thing happened. Have any of you experienced this? Well, personally, if you guys don't mind if I take this one, I've had this symptom with my optic neuritis. By some estimates, it's up to 80% of people with MS will experience the vision-related symptoms, the most common being optic neuritis. In fact, 20% of people living with MS experience optic neuritis as their first symptom. The condition simply translates to swelling of the optic nerve. So the optic nerve connects the eye to the brain, and MS can damage this connecting structure. It results in optic neuritis. Most people with optic neuritis, about 90%, experience pain when they move their eyes, and I do. It's so painful. The pain usually subsides after a couple days, even if your vision is still affected. Blurred vision, reduced light, flickering, flashes of light when your eyes are moved. That's called photophagia. I think it's the way you say it, right? Photopsia. No, it's photopsia is the way you say that word. Loss of color vision. That's chromatopsia. Let's see. Then you can get the blank spots in the middle. I definitely had that. That was one of my very first symptoms. Then they actually misdiagnosed that because of the blank spot in the middle. They called that, they call it scotoma, but they diagnosed me with central serous retinopathy. So that was my first misdiagnosis with my vision. But rapid onset with peak vision loss occurring within 1 or 2 weeks more commonly affects one eye at a time. In about 10% of cases, symptoms can occur in both eyes. That was in my case, it was both eyes. But either simultaneously or, in rapid succession. Now, I have had a few times that I've had optic neuritis that it was just one eye. That's when they would find a lesion behind one eye instead of both that was active. This last time I had it really bad, it was both eyes. They found new lesions behind each eye. So it can be either or kind of thing. And you can have kind of flares that aren't, a full-on attack with new lesions, where, you'll have inflammation in your optic nerve, tripped off just like any other part of our body, where we can have kind of flares of our symptoms, and it will go away. But if something's lasting more than 24 hours, go to your doctor, especially when it's your vision. Normally we're saying, if you have a new symptom that lasts over 24 hours and it's been more than 30 days since your relapse, call your doctor. And when it's my vision, I'm like, boom, I'm getting steroids because of having lost total vision more than once. So I that's just something I don't personally play around with. So that's something I will go faster for care. And anytime I've delayed it, saying, I think it'll go away, I've usually regretted it. And once their nerves and muscles are weakened by the disease, over time we start having other problems. We can have nystagmus, where your eyes shake, And then I have that as well. Presbyopia I have, and I have one eye that drifts over. It's like a weakness of your muscle where your eye kind of crosses. Actually, funny story. I noticed that symptom first from selfies. And my mom teases me endlessly over that one. I was taking selfies and I'm like, wait a minute, I must be doing a weird angle. It looks like my eye's crossing, and I kept doing it. And my eye was crossed. And she's like, I think it's your eye. I don't think it's the way you're holding the camera. And that's how I first noticed it, was in selfies, that my eye was crossing. So yeah, flickering and flashing, that's definitely can be a symptom of optic neuritis. So you definitely want to ask your doctor about that. And remember, we cannot see just any eye professional. It has to be an eye doctor, has to be an ophthalmologist. Hopefully you can find a neuro-ophthalmologist who is a specialist in multiple sclerosis. Anisha, have you had trouble with your eyes with your disease?
Lord, yes.
Lord, yeah. Good answer.
Yeah. I'm fortunate enough that, because of the, being on Plaquenil, I have to have the Plaquenil screening done. I think mine is every 6 months now.
6 months, yeah, that's how often I have mine.
Just how long I've been on it. And then also with, the issues that I've had with my eyes and things like that, I have all kinds of other tests that are, ran at the same time. I see a neuro-ophthalmologist. I'm so blessed for him. He's just amazing. And also, too, it's something very weird. There is some sort of connection with all the things that I have wrong, because I have nystagmus, where my eyes are like rolling around and, dancing around. But also my pupils stay dilated. They do not need to put any drops in my eyes to dilate at all. Nothing at all. They can see all in the back of the eye and do everything they need to do without any drops whatsoever. So I have to wear lenses in the summertime to keep the sun out, that they have to have specially made, because if not, it makes me very sick to my stomach. When I walk outside, it's just blinding, kind of even with the thing with the whole eclipse. I kind of live with that every day.
Yeah,
but
it's your life.
Yeah, I'm fortunate enough to see a neuro, ophthalmologist. And, again, steroid drops, if you ever have someone that's like just wanted to continuously give you steroid drops, tell you, I want you to use these every day for like the rest of your life, tell them it's negative, Ghost Rider, not doing that, because you only put steroid drops in your eyes for a short period of time, okay? And that's why Erica said earlier, it's important to see a neuro-ophthalmologist or, an ophthalmologist, somebody that is familiar with the disease, and not just, someone that's just like, oh, okay, well, I'm just going to give you this and this should be fine, because they could actually mess your eyes up even more. So those are very great tips.
They really can. And that I found that out when I was first seeing my ophthalmologist. I had went to see the neuro-ophthalmologist. I had the scan, of my optic nerves, and at that time did not have optic neuritis. And they were treating me for some other issues, though, that they found, and with my lupus. But then I had a huge, a relapse, and was having eye issues as well. And I went to the my ophthalmologist, and he said, I noticed that you opted out of this extra test. I said, oh, yeah, because it costs extra. My Medicare doesn't cover it. He goes, that's the test that would actually see your optic nerves, so we can see if, I'm like, oh, yeah, you know what? I'll be paying for that. Might have to skip some meals, but I'll be paying for that. And, even if it costs you extra outside of your insurance, if you really want to see what's going on with your disease and you want to catch that, so you can get treatment right away, you need to pay for that scan of your optic nerves. And, I've been left with, the blank spot and the, what is it called? Dyschromatopsia, the one with the dulled colors. I have some dulled colors that's permanent, but thank you, Lord, I have received back a lot of my vision each time. Some of it's diminished, but I'm just grateful for every bit I've gotten back since I have lost total vision more than once. It's made me so anxious that it will happen again, that when I sleep at night, I keep a tiny light on in the room at all times, because when I wake up, if I'm in a totally dark room, my whole body just like tenses up, like, oh my gosh, it's happened again. I've lost my total vision again. I think I've lost vision, in that moment of waking. So to prevent that anxiety from happening, I always sleep with a little tiny light on where I can see that no, everything's okay. My brain can see, okay, there's light in the room. So I've started doing that. And even if it's the TV on, somewhere or something, I'll keep some kind of light going since that time. That was a very good question. A lot of people have that as their first symptom.
Something else I want to just add here too, and I guess it just crossed my mind, that one of those squirrel moments. But another too is dry eyes.
Yes.
A lot of times when we have MS, our eyes itch. You know what I mean? They itch, and we're constantly, they're red, so we're putting drops in them and things like that. I want to tell you guys, over-the-counter eye drops, and I'm not going to say the names of any of them because I don't want no issues, but I'm just going to, over-the-counter ones are not good to place in your eyes every day. They are not good to do, okay? So picking up anything that says that it gets the red out and all that stuff, you don't want to do that and place that into your eyes every day. If you're noticing that you have a lot of dryness and itching with your eyes, you definitely want to get in with an ophthalmologist, because there is a autoimmune, and it's again on the rheumatological side, disorder called Sjogren's syndrome.
Yes.
And with Sjogren's syndrome, it brings about the dry eye and dry mouth, things like that. Anywhere where there's mucosa, it dries out. And then also with that can get so bad. For example, in my case, it was so bad I couldn't even blink my eyes. And when I would blink my eye, it was tearing my cornea. So I ended up with something, and this is a mouthful, called punctate epithelial keratitis. And what that meant was I had to get to an eye institute quickly because they thought that they were going to have to give me a cornea transplant. Luckily, we were able to cure it with about 30 days of 2 different types of steroids into the eyes. So that was a blessing right there. But if any of you guys are dealing with that, please, be mindful, because you might want to have some, things checked out, especially if your eyes so dry and itchy all the time. And number 2, so don't feel like I'm like weird or think of me like I'm asleep or something and ugly. But I tend to sleep with my eyes, they're a little bit open. I don't even know I'm doing it. You know what I mean? So I have to this it's like a salve into my eyes at nighttime, and once it goes in, I can't see anything. But it's to help keep that moisture in. They build a chamber. So I've had some eye surgeries, stuff like that, because the eyes they're very important. You got to take care of them.
You really do.
So.
That's why I don't play around with that, going to the ER. That's one thing I don't wait to see if it goes away, as much as the other symptoms. You really can't. And that a lot of us, even if you don't have the autoimmune diseases that Anisha and I have, you don't have Sjogren's and lupus as well. The constant attack on your 5th cranial nerve, which often, will look just like Bell's palsy. Well, it can cause that same nerve damage. And, you'll have eyes that droop and sometimes hang open, like she was saying, and they won't fully close at night. I have one that has a severe droop. And you really have to be cognizant of that. And the over-the-counter tears, synthetic tears, they won't always do the job. You might need a prescription, like she said. So don't play around with it. Definitely ask, because you're your best advocate. You will prevent all kinds of permanent damage by just asking, and research, so all these things can happen and how to prevent them before it even gets to that level. So that was good advice, Anisha. Okay, do we have anything else coming in?
It looks like we have one from Twitter.
Okay.
At Ask MS&Me. Do any of you experience itching scalp? I have never had anything like this in my life, and it started out of nowhere.
Oh, yeah.
That's a really good question. pruritus, which is the medical term for itching, it may occur as a symptom of MS. It is one of the family of abnormal sensations, such as the pins and needles, burning, stabbing, like something's tearing pains, which may be experienced by people with MS. Those are your more abnormal ones. These sensations are known as dysesthesia, and they are neurological in their origin. This aesthetic itching may occur suddenly and it's intense, but for brief periods. It may be present over any part of the body or the face. It is different from the generalized itching that can accompany like an allergic reaction, because that's going to be a surface itch when it's an allergic reaction. You know, when we're talking this aesthetic itching, it's deep because it's coming from the nerve stems, the nerve roots. Okay, as there's no external, skin rash or irritation at the site of the itching. Corticosteroid ointments applied to the skin are not helpful in relieving this kind of itch. They are just not helpful because that itch is deep. It's not surface, okay? There are some medications, though, that are usually successful in treating this aesthetic itching. Some of those meds, they are in the anticonvulsant family, which we talk about a lot of times, how some medications are made for one thing, but they're kind of like 2- and 3-fold because they'll work for other things. So in this case, with this aesthetic itching, Tegretol, which that's the medication that I take, it takes care of it. Dilantin, gabapentin, or Neurontin, antidepressants, which amitriptyline is, Elavil is its brand name. That medication is good with this aesthetic itching, but it's also good. It'll help a little bit with pain. Then it also works in the antidepressant family. And also, if you have any bladder issues, it's a little bit off the cuff, but just kind of giving you guys some knowledge here. Elavil is a medicine that will help with that as well. MAO inhibitors, antihistamine, Atarax, that's a pretty powerful one. As small as that pill is, it'll knock a horse out, okay? So,
Yep.
Atarax is one that will take care of this aesthetic itching. And remember, that itch is so deep. All you're going to do is scratch yourself till you bleed, because you're not going to be able to get to that itch, okay? So if it starts, because it will start to annoy you and drive you crazy, make sure that you get an appointment and you get in and you talk to your doctor about it, okay? And, make sure that you, again, consult your doctor right away as soon as you can, because usually once you start to feel it, you're going to it's kind of always going to be one of your symptoms that will arise. So,
and it'll ebb and flow, so it'll kind of come and go on you.
Sure.
And just and I know sometimes it's not possible while you're going nuts at night to get to your doctor or get care for something like that, because they don't consider it an emergency situation, but you will feel like it is. It's that deep of an itch, and like she said, you will scratch till you bleed. So a lot of people will find temporary relief. You can go in our groups and ask, and they'll give you all their personal relief for it. I found for myself, it's cold water, or ice in a rag, and if you just like kind of numb the surface. Sometimes I won't then touch it and scratch as much till I bleed. It's still going to be there because it's such a deep nerve itch. But that, for some reason, if it's just ice cold enough, it'll give me just kind of temporary relief, and hopefully my meds kick in and I go to sleep, and stop scratching so bad. Some people even put gloves on their hands, until they wake up, and can get to the doctor, so they won't scratch themselves in the middle of the night in their sleep. So that's another thing a lot of people do. But like she said, it's a serious itch. It's nothing like, having, people, they'll equate it to, having chicken pox, or, I had poison ivy. But it's even deeper than that. It's not the surface. It's way deeper. Okay, let's see if we got anything else coming in. Ted, do we have anything else coming in online?
Yes, we got something coming in from Twitter.
Okay.
Hashtag Ask MS&Me. Does anyone take naps during the day? Pretty much almost everybody does. with MS. I do. Well, I do. When I've been doing a lot, I take more naps than I do when I'm just lazing around, not doing anything. But fatigue is one of the most common symptoms of MS, occurring in about 80% of people. It can significantly interfere with a person's ability to function at home or at work.
Mm-hmm.
It is one of the primary causes of early departure from the workforce. I had to. Fatigue may be the most prominent symptom in a person who otherwise has minimal activity limitations. The cause of MS fatigue is currently unknown. Ongoing studies seek objective tests that can be used as a marker for fatigue and for precise ways to measure it. Some people with MS says that family members, friends, coworkers, or employees sometimes misinterpret their fatigue and think the person is depressed or just not trying hard enough. So there are several kinds of fatigue occurring in MS. For example, people who have bladder dysfunctions, producing nighttime awakeness or nocturnal muscle spasms, may be sleep deprived and suffering from fatigue as a result. People who are depressed may also suffer from fatigue. And anyone who needs to expend considerable amounts during their daily activities and stuff can also suffer from additional fatigue as a result. In addition to these sources of fatigue, there is another kind of fatigue referred to as lassitude, but is unique to people with MS. Researchers are beginning to outline the characteristics of this so-called MS fatigue that make it different from fatigue experienced by people without MS. It's characterized generally occurs on a daily basis, may occur early in the morning, even after a restful night's sleep. I get that.
Yeah.
It's to worsen as the day progresses. Tends to be aggravated by heat and humidity. Yes. Comes on easily and suddenly. Is generally more severe than normal fatigue. Is more likely to interfere with daily responsibilities. MS-related fatigue does not appear to be directly correlated with either depression or the degree of physical impairment. And then, is there ways to manage your fatigue? Because fatigue can also be caused by treatable medical conditions such as depression, thyroid disease, or anemia. It may also occur as a side effect of various medications or be the result of inactivity. Persons with MS should consult a physician if fatigue becomes a problem. A comparative evaluation can help identify the factors contributing to fatigue and make it possible to develop an approach studied to the suited for the individual's needs. Options for dealing with fatigue include occupational therapy, physical therapy to help with saving energy while walking and stuff, sleep regulations, which might involve treating other MS symptoms that interfere with sleep, spasticity, urinary problems, using sleep medication as a short-term basis, interventions such as management, relaxation training.
Yeah, that's a good one.
sports group, managing your heat, things like that can help with. I know for me, one of the things that helped with my fatigue was getting a sleep study and starting to use a CPAP mask.
Yeah, that's a big one.
So
a lot of people don't realize they have sleep apnea and that is a contributing factor to their fatigue or their sleep issues. So that's a very good. If you're having those times when you wake up and you just feel like you've never been asleep, you're still so tired, those are things to consider asking your doctor about. You might have obstructive sleep apnea. If your loved one is saying that you're stopping breathing, for periods of time, and you're snoring, those are all signals that you need to talk to your doctor about getting a sleep study. But
also too,
yeah, go ahead.
Keep in mind that if you have MS, sleep hygiene is very important. Sleep hygiene is very important even if you don't have MS.
Yes.
Okay. Sleep is it's an important thing to do. So, one thing that may help people is, as I kind of talk about quite often, is to, have your day mapped out, over the 24-hour kind of time block, and schedule yourself a couple naps.
Yes.
What time you're lay down and take that nap, what time you're going to wake up. Even if you set alarms to do so that you're not sleeping too much during the day, because that could be the issue, is that some people sleep too much during the day, then they end up not being able to fall asleep at night because they're getting their most productive sleep during the day. So it is a kind of a balance sometimes of figuring out, what's going on. And during my sleep study was when, it was discovered that my brain was not shutting off.
Yes.
It wasn't.
Mine wasn't either. Yep. I had the same issue.
It was still going. And so instead of things like, Ambien or things of that nature, which I'm afraid of, we went with, Elavil in order to, it works wonders, in me being able to, get some sleep. Now, do I have some difficult nights where my pain is so bad that I still can't sleep? Yes, I do.
Right.
I do. I admit it. But, it is what it is. It's part of it, and you just kind of work your way through it and still try to stretch and, get a walk in and, all those type of things that are, pretty good for you to give your body a little bit of something to do so that it's not always at a rested state, just give it a little something, that you're able to. So
it's very important. Great advice, because, sleep is when we get that restoration. Remember, when they call it restorative sleep, they're not kidding. Remember, there's a lot of things that go on in our brain when we're asleep, and that's when some things shut down and they restore. So that's very, very important. And then those naps during the day. Now, I've noticed, nothing's an absolute, but I've noticed that earlier in disease progression, more patients say, that, well, if they get too much sleep or take a nap, then they can't sleep at night. However, as we progress more, I've noticed that's when those restorative naps really become important. Scheduling those on a schedule, promising yourself that's when I'm going to get that rest. And then a lot of disease activity stays more, in control. Like you said, sometimes they rear their ugly heads and do interrupt our sleep. But we do have to try to schedule that regular sleep and get as much sleep as we can to get that restorative value to it. When Dr. Pat Farrell was on our show, she discussed that, and she has a book as well that we put on our site. So that's a great tool to get extra information. So if you guys have more questions, go ahead and submit them for next week's Ask MS&Me. That's hashtag Ask MS&Me. You can also get additional information on our website, www.msandmemedia.com. We'll see you guys back here next week, same time, and the show will, of course, re-air. So go on our website to radio.msgsn.com and get our current schedule. Have a great week.